Means to you. I'm joined by Anna Mathews, a Dow Jones consumer health columnist who wrote a piece on this very topic in the Wall Street Journal. Ron Mitchell, a small business owner, as the CEO and co-founder of the career development firm Got a Mentor. Craig Baldo is a writer, comedian, and finalist on NBC's Last Comic Standing. And Jeffrey Kraws is CEO and co-founder of Crystal Research Associates. Good morning, everybody. Thank you guys for being here. Anna, let me start with you. Did the president move his agenda forward last night? Did he do a good job?
You know, it's a little too early to tell, but he certainly was trying to reach out to people who are skeptical about the need for reform. Some polls have shown that only 39% of people, when asked if they think reform will help them and their families, said yes, and 52% said they didn't think it'd make much difference or it would hurt them. So the president is trying to reach out to those people and explain to them how it will help them.
Ron, you're a small business owner. Big implications potentially for small business owners, particularly if there is a tax on health care benefits, if you're making a certain amount of money or higher. What do you believe he's demonstrated thus far in terms of the small business community and how it'll impact them?
Well, it's really amazing. It's unfortunate you weren't in the room last night, Alexis, because there was not a single question asked to the president about small business owners and the effects of health care on small business. It is a major issue. It has to be addressed. My little business itself, premiums went up 20% last year. So what does that mean? It means you ask the question of whether or not you should even provide health care, or you reduce benefits or increase deductibles. And so the health care package, as it's sort of proposed by the House, is very interesting. That pay or play will not adversely affect most small businesses. That 8% that you pay is actually less than what most small businesses do currently pay as a percentage of compensation for health care. The issue is if the president is wrong, or Congress is wrong about the costs, which the CBO believes to be true, and I believe to be true, in which case it could have significant effects, adverse effects on small businesses.
I'm going to get back into that in a moment. Craig, I want to get your reaction because you didn't have health care insurance, as I read, for 6 years.
6 long years, yeah.
What was that like? Do you think the president's doing the right thing here?
I do. You know, I would have gone skiing a lot more if I had health insurance, you know. Like, I took a little bit more caution crossing the street, and it put a lot of burden on my parents. You know, they hated it, and it was kind of scary. You know, I was an artist. That was basically my thing, which you know, I would gladly do it over again. But you know, for 6 years, and it was in my late 20s, so it was a little bit, you know, more like I didn't worry as much because I felt, you know, like I was invincible. But like now, you know, I'm getting up there a little bit. I'm, you know, my mid to, well, you know, early 30s, let's say. It's a little bit more of a concern for me because, you know, it's older age, right, guys?